it's time for health, and we've got the prof himself. I just feel like when I say prof, I'm thinking that am I in my HOD's department and I'm about to, present a case to him. But no, this is your health, and of course, it's Professor Bade Adewale. He's an acupuncturist, but today we're talking about frozen shoulder, and we're going to explore what it means or what exactly is frozen shoulder and how you should go about it. It's not just straight into acupuncture, as it were. Prof, it is great to have you. You're welcome.
It's nice to be back. Eh?
You're wonderful, wonderful. What do we, when you say frozen shoulder, what do we mean by frozen shoulder?
Just as the name implies, when your shoulder is glued, you cannot move it. It is stiff down there. And in medical parlance, it has been described as the swollen range of movement is limited, and sometimes it's only affecting just one shoulder. If you look at the complexity of the anatomy of the shoulder, there are so many components there. We have the scapula, we have the clavicle, we have the glenoid cavity, we have the humerus. And then don't forget that this joint is being held by atmospheric pressure, so it could be easily dislocated. But what happens when the shoulder is frozen? There are a lot of crystals of calcium that are deposited. That is why they sometimes call it capsulitis adhesive. Capsulitis adhesive. So inside that capsule, we have a lot of crystals of calcium that are deposited there, which could now give a form of symptoms of frozenness, tenderness, inflammation, and all the rest of it. And usually, the first form of intervention naturally is when you are having that kind of problem, you take a mild analgesic anyway, because you might be thinking it's ordinary pain. And then in such situation, when you take some analgesic, and that is why the advert always says, if you take this medicine for 3 days, consult your doctor.
If system persists, yes.
If it persists like that, then it means you have to seek further help. What are those kind of help? Probably you go to people who are more inclined. I'm talking about people, rheumatologists and orthopedic surgeons. And what they will do usually is there are many things they could do. First, if there is a swollen and tenderness there's what we call needle aversion. We could insert needle there to extract some fluid that could have gathered there. And secondly, they could actually inject that joint with non-steroid anti-inflammatory preparations, which will reduce the pain. Although that's not really advisable. And a lot of medical experts are now canvassing against it. Then, lastly, you could now go for surgery if those calcium salts are substantial, because if they are not removed, they could impede the movement of that mobility. Joint. Don't forget, this is ball and socket joint. Then apart from that, there are a lot of physiotherapy interventions that can be deployed, such as shock wave diathermy, transcutaneous electrical stimulation, short wave diathermy, shock wave, and all sorts of heat therapy that can be deployed. Now, when all these things fail, and don't forget that all this intervention may take up to 3 years. That's why you see a lot of people with frozen shoulder there. Some of them will be strapped. They can't move it. But the good news is that acupuncture can relieve this thing sometimes within few days of visiting to an acupuncturist.
Few days?
How is he going to do it? You can see the acupuncture manicure.
Yes.
There are a couple of points on the shoulder. At least I'm going to mention just 3 of them. We have them here, and there. The one very close to the acromion process is called Jian Yu. We have Jian Liao. We have Jian Zen. Jian in Chinese means shoulder. So all those points can be utilized, and then you use the distal point here, which is for analgesic, which is LI4. Then the one I did to Clemens Westerhoff when he was the coach of the Super Eagles, he couldn't move his hands for days. After they have deployed all sorts of non-steroid, all sorts of analgesics. So I was invited. When I wanted to treat Westerhoff, he wanted to be removing his chest. I told him, no, relax. I put the needle somewhere around the leg here. There is a point here which is called Tioku. When you insert the needle here, you see the patient moving the hand. Even if he has not done that for 3 years, he will lift up the hand immediately with acupuncture. Don't forget that we say there are some points here too. So, Choku, then all the points here and this one can actually relieve someone who is having a very chronic of a frozen shoulder. So frozen shoulder is not a thing to be treated with levity, because if you don't manage it very well, it could be very, very serious and it could damage your shoulder, know. So it calls for an expert intervention.
But something you said earlier that acupuncture should not be the first point of, or the first thing that you go to do? Why so? Why?
It could not be. The reason is, how many acupuncturists do we have in Nigeria? They are very limited in number. So
exactly,
sometimes it could be a problem to get in touch with an acupuncturist. But if you are fortunate to get one, if you have gone to the hospital and you have taken your analgesic, see an acupuncturist. It will free you from all this trouble. That is for sure. So that is it. So it is good to see an acupuncturist when you're having issues like frozen shoulder.
Are there any ways, are there preventive measures that one can take when you get to a point where that you think that or let's say susceptibility?
Yes.
What are the most susceptible, and are there preventive measures in this kind of
situation? The issue is calcium is very essential for bones, so we cannot say people should not take calcium.
Okay.
I mean, but sometimes the body may not do justice to that calcium appropriately, and that is why it could be deposited in some joints.
In some joints.
Like this place. So what you could do in that situation is probably take something that can counteract the effect of calcium. Maybe something like milk, when you are talking about nutrition, But then you know that you should not even take milk into excess.
Yes.
So, and another thing is you should also exercise to free your shoulder. Don't always keep your shoulder in one spot like this. There are some professions that keeps you in one solid spot like that. Like when you are operating your computer, you are always like this.
Yeah.
The shoulder is not moving. You have to free the shoulders. That is why when you are doing your aerobics, emphasis is always laid on freeing the joints, especially the shoulders, so that your shoulder is not frozen up. Because when you don't move the shoulder properly, your shoulder could be frozen up. And when that happens, all you need to do is try to practice some mobility exercise that will be able to free your shoulder.
Okay.
But Go ahead. But when there is a limited amount of freedom, it has to also be properly investigated, because it might not be frozen shoulder. We have so your shoulder could be dislocated.
Okay.
Sports.
Yes, if you're in sports.
Because I told you that the glenoid cavity is very fragile. The shoulder can be dislocated. Yes. If that happens, it has to be properly treated by an orthopedic surgeon who can fix it back into that cup there. So if that is not, and after that is done, if you are still feeling some pains, take some pain reliever. If that pain reliever will not solve the problem, you see an acupuncturist. Right. You fix the problem.
Prof, I wish we had more time to round up here. How can you be sure that you don't get a quack when it comes to searching for an acupuncturist? Is there an organization? Is there a database? Is there any way one can access information on people who are qualified acupuncturists?
That is a very good question, because I tell you what, one of the problems we are facing in this profession is proliferation of quacks and charlatans. And that is not really helping matters, because a lot of companies are coming into Nigeria in the name of networking, promoting the use of machines for acupuncture. Machines don't do acupuncture. Acupuncture is only done with needles, special needles that are inserted into some selected points. These points that are marked are not just marked for cosmetic sake. The precision is very, very sine qua non in this case. You must make sure you get the right place to put the needles. And you don't just put the needles anywhere, because there are some places you put the needle and you may cause problem for your patient.
True.
So, and those are called dangerous points. We have dangerous points and we have forbidden points. But if you are trained or you patronize an acupuncturist that is duly registered by Nigerian Medical and Dental Council.
How can you find this out?
So you will find out if you are privileged to consult people like us.
Okay,
that could be, but because it's essential that you patronize people that are licensed by government, by federal government, and that is Medical and Dental Council. That is the body that regulates healthcare practice
around the country,
so that you don't fall into the hands of quacks and charlatans.
Prof, so it's been a pleasure watching you all through this month, and hopefully we'll have you for one more time. Thank you so much, sir.
Thank you.
It's a pleasure. All right. Hope you're able to pick something there. For me, the major takeaway point is that ensure that the person is registered by the Medical and Dental Council. Ensure that you don't get to a quack. Make person nobody choke you. When they don't carry needle, put needle in your eye and says put needle in your eye and say acupuncture. It's your body. Be careful. Put needle anywhere. All right, we'll take a time out now. Stay with us. We'll be right back.